Well, in Australia, we have a very wide range of excellent health services, facilities, and providers. But in order to avail yourself of these to your benefit, you need to know where they are and how they find them. And also, please bear in mind that we have many older citizens who are not born in Australia, for whom English is not their first language, and who are totally confused when they have to try to get some essential information about a local health service off the web. These things can be improved, but they need to be. Consumer-led care is a great advance in terms of respecting the rights of people, be they people with disability, be they older people. The new programs that allow the patient or the client to choose how to spend the assistance money that's been provided is a great step forward. But for all of this to work very much in the interests of the person making the decisions, that person may often need assistance and advice.
The most important issue facing people with disabilities in terms of healthcare services is the same issue that I think faces us in terms of the community generally, and that is the negative and limiting attitudes which the community has towards people with disability. And what we experience is the soft bigotry of low expectations, and so that flows into the healthcare system. So the healthcare system doesn't always take account of people who use wheelchairs and can't get up onto couches in doctors' surgeries for examination. That doesn't take account of people with a hearing impairment who perhaps can't easily communicate with staff in hospitals, or a person who can't see, who can't understand what's going on in an unfamiliar environment. So the healthcare system just needs to get better at recognising the impact of disability and properly addressing it. Any change in healthcare to improve the way healthcare is delivered is going to benefit people with disabilities. We're 1 in 5 in the population. We have the same health issues as everyone else.
Improving healthcare services really requires us to value the individual and to give them opportunities to use their strengths. And when we do that, they thrive and the community benefits from it. So really the challenge for the mental health system is to actually re-engineer our responses so that they're around the person, and that includes families and carers. And then to focus on recovery, which really means that each individual gets a chance to direct their own recovery journey, to set their own goals for life and their own aspirations. To really improve services, we need to change the way in which people work together, and we need to adopt collective impact approaches. We have to somehow get ourselves out of the silos of government and ministerial responsibility, which often sees us working in isolation. There's real urgency in this. The fact is 1 to 3% of the population live with severe mental illness, schizophrenia, bipolar disorder and similar disorders, and they have very, very poor health outcomes. They suffer significant discrimination. They often miss out on basic services, particularly, for instance, physical health checks for people living with severe mental illness, such that they're dying 10 to 25 years earlier than the rest of us. And they don't die of mental illness. They just die of failure to respond to their broad needs.
When we consider Indigenous health or Aboriginal and Torres Strait Islander health, we need to do so in a way that recognises what's already in play. We know the statistics, we know that, and the key statistics is that Aboriginal and Torres Strait Islander people die on average 10 years younger than the rest of the population. When you look at comparative countries, New Zealand, Canada, America, the gap is only 6 to 7 years. So why is that a problem over here? We can't just look at one aspect of health. We've got to look at what we call the social determinants of health, and for Aboriginal and Torres Strait Islander people and even minority culture peoples, we've got to look at the cultural determinants of health. Well, I think some of the most important considerations for healthcare in Australia really revolve around the quality of the workforce and the reach of the workforce. So it's a real challenge to be able to retain people and to be able to get access to specialist services in regional and remote Australia.
Attitudes towards people with disability could be significantly improved by better training or better disability awareness. So I don't think that people with disabilities overall need a lot more resourcing in the health system. It's just changing the approach. Limiting assumptions are made about people with intellectual disability. So doctors and hospital staff don't necessarily more carefully inquire into a person's health. And so healthcare outcomes are of a lower quality for people with intellectual disability as a result. That's the sort of thing that I'm talking about. As with any workforce, it should reflect the breadth of the community and the diversity of the community. So if there aren't people with disabilities in the healthcare workforce, then of course it won't do that, and the appreciation of the impact of disability won't be as well understood in the same way as if there weren't people from different cultural and linguistic backgrounds.
I'd very much like to see health professionals working in teams so that you have the general practitioner, you have a physio, you have a nutritionist, dietitian, and you have your X-ray technology close at hand, so that when a person goes for some sort of health care, most of what they need is under the same roof, or at least on the same block. Now, this occurs in some places in Australia. Some places have health centres where there's the range of things that a person needs, but other places don't have it. So I think we do need much more public, accessible discussion about how to be a healthy person, a healthy man or a healthy woman. And we do need the information that our health providers put out to be much more accessible to average people, or people for whom English is not a first language, people who didn't grow up with the internet. All of those ways of finding things out can be unhelpful if the need of the end user isn't borne very much in mind.
And to be able to upskill people who live in remote areas are real challenges. And we have to start looking at some of the modern technological approaches to things like e-health, telemedicine, teledentistry and so forth. Things like employment, education, safe home environment, not overcrowded housing, making sure that our mental health issues are addressed. These are what we call the determinants. They're the impacting factors on somebody's health, and we need to make sure that they're all addressed if we're going to see a good health outcome, because medicine alone can't achieve a good health outcome. When we talk about cultural determinants, we're talking about issues relating to the ability of a person to be able to express their own culture in a way that they can do that freely, to be able to express their language, to be able to practice their language and culture, and they have a fairly significant impact on people's mental health and social and emotional well-being.
The National Disability Insurance Scheme is potentially a real game changer. For people living with disability, it puts the client at the centre and allows them to choose a suite of social supports that suits their needs, not someone else's. In psychosocial disability, that's really important because it means that someone's entire quality of life may depend on their ability to have support in education, employment, day-to-day living, and even in relationships. So it's absolutely vital that we go down this path.
The main barriers to people getting good health service are often regional, geographical. It can be just that there isn't the service that they need close by, and that's certainly true of newly developing areas like mental health. Well, Australians are enjoying greater longevity than ever before, and that's a wonderful thing. Australians are actually experiencing better health for more years than ever before. But Australians are also, in their older years, facing age discrimination, particularly if they want or need to have paid work. Employers often don't understand the improved health and the improved longevity implications. And so older people are often pushed out of the workforce for reasons of age prejudice. That means our workplaces need to be adapted so that an older person who may have a minor health issue, a physical issue or another issue, can be supported so that that person can continue to be a productive employee and continue himself or herself to have the benefits of an income and all of the other benefits that paid work brings. Well, every human being has the same human rights, and Australia was one of the first signatories to the Universal Declaration of Human Rights back in 1947 that says just that. We all have basic rights to dignity, to health care, to freedom, to respect, to opportunity, to choice. Now, those rights do not diminish as you get older. You have the same rights at 90 as you had at 9. And sometimes, without meaning to demean the older person, a health service provider can overlook the rights, the basic human rights of an older person. So when we're designing health policies and processes, when we're training health professionals, allied professionals, at the centre of all this should be the recognition that human rights remain with a person throughout their life, and make sure that all of our policies and practices are based on a recognition of the human rights of everybody.
Some of the significant barriers to achieving good health outcomes have to be around good health literacy in a language that people can understand and respond to. It's about a great population health approach and making sure that the community is given information and empowered to take control of their own health. And I guess the third big one is trying to get health professionals and governments to understand more about social determinants of health and the cultural determinants of health when we're working with Indigenous and ethnic minority communities. Because we've got to look at it from a holistic point of view. From an Aboriginal person's point of view, we see health, our physical health, our mental health, our social and emotional well-being all intertwined, and we see the whole person and how we fit into our environment.
I think the question that isn't asked more generally in the health system is what are the particular issues which you as an individual face? The system inevitably provides sort of packaged solutions which work for some members of the community but not for others. We need to have a system which is far more personalised. The rights and dignity of people with disabilities matter just as much as the rights and dignity of any other person in the community.
If there's a question that needs to be asked more strongly in the healthcare debate, I think it's what the individual should do for himself or herself. We do hear a lot about doctors need to do this and nurses need to do that, and we need more trained people in various areas. But at the same time, I think the basis of a person's health is a person's own choices. You can be unlucky and things just happen to you. But on the other hand, people need to take responsibility for themselves. I'm pleased to see in a lot of our school curriculums these days, we're seeing a lot of emphasis on diet, exercise and so on. Even in primary school, children are learning that they need to look after their own health.
And so justice health is very, very important. We know that many people who commit crimes in the Aboriginal and Torres Strait Islander community have very low literacy and numeracy capacity, and so when you start to understand that, you understand why some of the petty crimes are taking place. They're not significant, and we just look at mental health of prisoners, and you say, gee, if you could really address that before they start to offend, we might cut down on crime. If that is one of the contributors.
We're not asking some of the big questions, and we really must. For example, why is it that someone living with a mental illness has their social supports responsibilities sitting within inside the health portfolio? Why wouldn't those supports sit within inside family and community services, which actually has expertise with individual and family functioning? We really need to look at that continuum of care, and I think there's an opportunity to really question why we wouldn't combine the whole social support system through the Ministry of Health and Family and Community Services into one organisation. There is much in all of this discussion to really challenge the best and most creative minds in government, academia and the community. And let's face it, a lot depends on it. Lives depend on it. As a civilised society, we can and must do better.